What's up, everybody? Welcome back, or if this is your first time, welcome to my channel. And in this video, we're going to be talking about medications. Studying medications can be quite challenging for social workers taking the LCSW or LMSW exam. However, once you get this part down, you're pretty much good to go. These questions are usually very straightforward, where you're provided with the disorder and you have to recognize the correct drug, and it has nothing to do with your reasoning skills. While it is important to study medications, try not to worry too much about them because you probably only get like 1 to 3 questions on this particular topic. However, that 1 to 3 points can be the difference between passing or failing the exam. There are 5 main types of psychotropic medications, which include antidepressants, anti-anxiety medications, stimulants, antipsychotics, and mood stabilizers. Learning to recognize the medications will help you get that easy 1 to 3 points. Antidepressants are medications used to treat major depressive disorders, some anxiety disorders, some chronic pain conditions, and to help manage some addictions. Common side effects of antidepressants include dry mouth, weight gain, dizziness, headaches, sexual dysfunction, and emotional blunting. Anti-anxiety or Anxiolytic is a medication or other intervention that reduces anxiety. This effect is in contrast to anxiogenic agents, which increase anxiety. Anxiolytic medications are used for the treatment of anxiety disorders and are related to psychological and physical symptoms. Stimulant medications is an overarching term that covers many drugs that include those that increase the activity of the central nervous system in the body. Drugs that are pleasurable and invigorating, or drugs that have a sympathopathic effect. Antipsychotic medications, also known as neuroleptics, are a class of psychotropic medications primarily used to manage psychosis, principally in schizophrenia, but also in a range of other psychotic disorders. They are also the mainstay, together with mood stabilizers, in the treatment of bipolar disorders. A mood stabilizer is a psychiatric medication used to treat mood disorders characterized by intense and sustained mood shifts such as bipolar disorder and the bipolar type of schizoaffective disorder. Just remember, licensed social workers are qualified to assess, diagnose, and treat mental and emotional conditions and addictions, but cannot prescribe drugs. If a social worker learns more about the medications their patients take, including their intended outcomes and reactions, they can become better social workers and better members of their interdisciplinary teams. Social workers, along with other team members, should be knowledgeable about medications so that they can address related treatment issues with their clients. So if medications was an issue for you before, don't worry about it. Like I said, it is important to know, but there's not a lot of questions on the exam about this. If you enjoyed today's video, let me know in the comments below. Please don't forget to like, share, subscribe, so I can keep producing more content like this, and it lets me know that I am helping you on the road to getting your license. Until next time, I'll see you in the next video. But wait, don't forget, I gotta ask you some questions.
Adderall or Ritalin are blank medications used to treat attention deficit hyperactivity disorder (ADHD) and narcolepsy. They increase alertness, attention, and energy. A. Depressants. B. SSRI. C. Benzodiazepines. D. Stimulants. D. Stimulants. Stimulants are medications generally used to treat attention deficit hyperactivity disorder (ADHD) and narcolepsy, which is uncontrollable episodes of deep sleep. They increase alertness, attention, and energy. Blank are psychiatric medications used to treat disorders characterized by intense and sustained mood shifts, where a person's mood changes from a depressed feeling to a high manic feeling, or vice versa, such as bipolar disorder, and the bipolar type of schizoaffective disorder. A. Stimulants. B. Antipsychotics. C. Mood stabilizers. D. SSRI. C. Mood stabilizers. Mood stabilizers are medications used in the treatment of bipolar disorder. Lithium, anticonvulsants, and antipsychotics are the three main types of drug which are used as mood stabilizers. There are several types of individual drugs within each of these groups. Which is not an antipsychotic medication? A. Sertraline Zoloft. B. Quetiapine Seroquel. C. Risperidone Risperdal. D. Aripiprazole Abilify. A. Sertraline Zoloft. Sertraline is in a class of antidepressants called selective serotonin reuptake inhibitors, SSRI. It works by increasing the amounts of serotonin, a natural substance in the brain that helps maintain mental balance. Quetiapine, risperidone, and aripiprazole are in a class of drugs called atypical antipsychotics. Blank is a type of antidepressant drug that inhibits the reabsorption of serotonin by neurons, so increasing the availability of serotonin as a neurotransmitter. A. SSNI. B. Benzodiazepines. C. SSRI. D. Antipsychotics. C. SSRI. Selective serotonin reuptake inhibitors, SSRI, are the most commonly prescribed antidepressants. They can ease symptoms of moderate to severe depression, are relatively safe, and typically cause fewer side effects than other types of antidepressants do. A 41-year-old man is admitted to the emergency room after being found wandering naked in a local park. When the social worker interviews him, he speaks rapidly, seems euphoric, and repeatedly tries to tell the social worker about his plan to create a major art piece in the park. With careful questioning, the social worker is able to discover that the man has a family history of bipolar disorder and was recently put on medication by his psychiatrist. What medication was the man most likely given? A. Depakote. B. Lithium. C. Ativan. D. Citalopram. D. Citalopram. Citalopram Celexa is an antidepressant that can, in some cases, induce a hypomanic or even manic episode. Many antidepressants run this risk if the person is predisposed to a mood disorder. Lithium and Depakote are used to treat mania. Ativan is used to treat anxiety. Blank are medications used to treat major depressive disorder, some anxiety disorders, some chronic pain conditions, and to help manage some addictions. A. Stimulants. B. Antidepressants. C. Antipsychotics. D. Mood stabilizers. B. Antidepressants. Various antidepressant medications are available for prescription use. There is no single best antidepressant, and the best one for the client depends on a client's symptoms and individual needs. Antidepressants help balance the levels of neurotransmitters, which are chemicals responsible for communications between neurons in the brain. These chemicals include serotonin, dopamine, and norepinephrine. While antidepressants can be helpful in depression, effectiveness varies from client to client. Blank medications help reduce the symptoms of anxiety such as panic attacks or extreme fear and worry, and make it easier to sleep. They are also used as a muscle relaxant to induce sedation for surgery and other medical procedures, and in the treatment of seizures and alcohol withdrawal. A. Mood stabilizers. B. Antipsychotics. C. SSRI. D. Benzodiazepines. D. Benzodiazepines. Benzodiazepines, sometimes called benzos, is depressant psychoactive drug which lowers brain activity and are prescribed to treat conditions such as anxiety, insomnia, and seizures. Benzodiazepines act on the central nervous system, produce sedation, and muscle relaxation. Benzodiazepines are commonly abused. This abuse is partially related to the toxic effects that they produce and also to their widespread availability. Which medication is a mood stabilizer that is effective in treating bipolar disorder? A. Buspirone Buspar. B. Alprazolam Xanax. C. Lithium. D. Fluoxetine Prozac. C. Lithium. Lithium is a mood stabilizer medication that works in the brain. It is approved for the treatment of bipolar disorder, also known as manic depression. Lithium can also help reduce aggressive or self-harming behavior. Buspirone and alprazolam are used to treat anxiety. Fluoxetine is used to treat depression and obsessive-compulsive disorders. Risperidone is a second-generation medication also called an atypical blank, which is used to manage conditions that affect the mind, and in which there has been some loss of contact with reality, often including delusions, false fixed beliefs, or hallucinations, hearing or seeing things that are not really there. A. Antipsychotic. B. Stimulant. C. Antidepressant. D. SNRI. A. Antipsychotic. Antipsychotics, also known as neuroleptics, are a class of psychotropic medication primarily used to manage psychosis, including delusions, hallucinations, paranoia, or disordered thought, principally in schizophrenia, but also in a range of other psychotic disorders. They are also the foundation, together with mood stabilizers, in the treatment of bipolar disorder. A social worker is meeting with a client who has a history of depression and has tried both selective serotonin reuptake inhibitors (SSRI) and norepinephrine dopamine reuptake inhibitors (NDRI). Which of the following would be the next best pharmacological therapy his psychiatrist may prescribe? A. Tricyclic antidepressants. B. Antipsychotics. C. Mood stabilizers. D. Acamprosate. A. Tricyclic antidepressants. Tricyclic antidepressants are a class of medications that are used primarily as antidepressants, which is important for the management of depression. They are often used when other drugs are unable to provide relief.
If you enjoyed this video, hit that notification bell, subscribe to get notified of all my new releases. Thank you.